Okay, so you're noticing pain in any movement. How would you describe that?
I loved it. That was amazing. Oh yeah.
Notice the difference?
Yes, big time.
Good.
Big
good.
time. Okay. I wish you would have told me to do this earlier. I couldn't do this at all. I could not do that at all. Seriously, I could not do that earlier this morning.
You couldn't even move your leg?
I could not do that at all.
Okay. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now she is experiencing very bad right-sided pain, correct?
Yes.
Alright, so it's the right hip, and it's going down into your leg, correct?
Yes.
Now, as you originally described to me before, it would go from here, and you'd feel it to about here, but now you're starting to, it's going past the knee, correct? Past the knee into the calf. Does it ever go into the feet?
It has not yet.
Okay, has not yet, but it has been progressing that way.
Yes.
Okay, how long has this been going on for?
This has been going on since October.
Okay, October, now we're in January, so you've been dealing with this for quite some time.
Yes.
Now, I know, as you told me, you've been going to other places to try to get relief.
Nothing.
Nothing. Okay. So you've tried other chiropractic care. What else have you tried? Any?
That's it.
That's it. And then ice pack, heat packs.
Yes.
Okay, things like that. And then the over-the-counter medication.
Yes, ibuprofen.
Okay. All right, and still no relief.
Nothing.
Okay.
In fact, the ibuprofen's not even helping me at this point.
You're still with the pain.
Yes.
It doesn't even
so bad.
cut the pain at all anymore.
That's right.
Okay. Well, let's go ahead and we're going to do some range of motion because I know everything is primarily lower. I'm going to have you stand up.
Okay.
All right, I want you to just bend forward at the waist for me. Okay.
I'm sorry.
No,
I'm sorry.
I'm trying to get a baseline. I'm trying to not trying to be mean. I'm trying to instigate and trying to recreate that pain.
Yep.
Granted, you know when you went forward, you don't got to do it again.
It's just so bad.
Okay, yeah, you don't got to do it again.
Okay.
So you felt that pain, and it goes down the leg, correct?
Yes.
Okay. If you lean back like this, yeah, that's pain.
Yeah.
Okay. So even when you go back, now can I have you point to it for me, like on your back?
On my back. Okay.
Yep.
When I go down, it's right here, and it just goes straight down my leg.
Okay. So
And when I go back, oh, it's right here.
Okay. So same spot both times.
Yes.
So right here, and where that is, right there, that's her right SI joint. Is exactly where that's. You feel this that I'm pushing on? All that. That's entirely her right SI joint. If you're to bend down to either side. Okay. So you're noticing pain in any movement. There's no point in doing it anymore. We already know that. All of them are going to create a positive. So we know that. What I want you to do, I'm going to have you lay face down. I'm going to have you take the necklace off just so it doesn't get in the way.
It was very cute, though.
Thank you. And then I'll have you lay face down for me.
Okay. Oh my goodness.
Okay. Now, do you notice any pain just with?
Oh yeah.
Okay.
Yep.
So even laying down, like with this position, you're noticing the pain, and it's going right into that leg.
Yep.
Okay. So yep, I'll have you lay your face right there. We'll bring your arms perfect right there. So granted, we already know that everything is coming from that right side, and it's been going on for months. Now, have you been in this amount of pain for that many months, or is it?
It's progressively gotten worse.
Okay. So it's been.
It didn't start out as bad, but then about a month after I was starting to have pain, I finally went to the chiropractor and started getting the adjustments, and I was not getting relief.
Okay.
And it's just got worse.
Okay, so yeah, as I know you've seen some of my videos, I do things a little bit differently. So especially when it comes to the low back and the hips, I do a different type of drop technique, and we are really going to focus on that today. The other chiropractor that you had, does he or she do the side posture, kind of like bending you into a pretzel type ordeal?
On the side with my leg.
Yes, like you're like bent.
Yes, and yes.
Okay, so you are familiar with that, but that's still not getting any relief.
No.
Okay, so yeah, we're gonna do things a little bit differently today. So how I like to start all the adjustments is we're gonna scan the entire body. So we're gonna be checking all the way from that cervical spine, going all the way down to her feet. Now, granted that we know her chief complaint is here, I still like to palpate all the way from that cervical spine going down. Even like right now, I'm noticing right here on this right side, on that rib cage, it is raised up here on the right, so we're going to do some adjustments right through here as well. So I'm going to start with palpating. Let me know if any of this is tender to the touch. Okay, so we go from that cervical spine into the upper back, into that thoracic spine here. And we're just following that thoracic spine down in that mid-back. Okay, now we're getting into that lumbar spine. How's that feeling for you?
Mm-hmm.
Good?
Yes.
Okay, so no pain, which is a good thing right now.
That's where it's starting.
All right, now it's starting here. So I'm not gonna. We already know that that's painful. So we're not gonna do anything there to further inflame it. I'm gonna come down here and I want to take a look at her leg length. So, as you guys can tell, right short. And even how I moved that leg, that I could tell I heard that also on you. That did not seem quite well for you. What we're gonna do first, just because we're getting that right short leg, you have a lot of pain here. It's also causing other areas in your back to kind of tighten those muscles. So I'm gonna first do the massage device, and we're gonna relax everything from the cervical spine going down, and then we'll start with the adjustment.
Cool.
Okay, so I'm gonna just go very light over this area. How does that feel when I do that? That's fine?
Yes.
Okay, good. Alright, so how I start every adjustment, I like to start at that cervical thoracic junction up top here. Okay, so we're going to start on the left side. We're going to do a T2 on the left here. Good. I'm going to drop down just a little bit, T3 on the right. There we go. I always like starting that, just opening up those nerve pathways, you know, allowing that message to get sent out with no pressure involved. Okay, so we're going to go in that upper thoracic spine area. I want you to take a deep breath in and exhale out. Good. Drop down just a little bit here. Deep breath in and out. Good. Okay, so we're going to come down here, check the leg length. So we're going to just move the leg just a little bit here. Better. Even just with that, a lot better. Still a little short. But what I'm going to first have you do, I want you to sit up on the table for me.
Okay.
Straddle the table, one leg on either side, please.
Right now?
Yep.
Okay. Wow, a bit better actually.
Alright, I'm going to have you give yourself a hug. Bring that, yeah, just like that. Good. I'm going to go right here. So I want you to keep your thighs to the table.
Okay.
I'm going to rotate you all the way this way. I want you to look as far as you can over that shoulder too. Good. There we go. Perfect. Yeah, that right side is the one that really needed that. I want you to lay face down again for me.
Okay.
And that I heard, I know you felt, but I heard a lot of the popping and the cracking. So yeah, we're just needing to realign that spine there. Okay. Even with that actually helped balance. It's still a tiny bit short here. But now this is going to be one of the main ones that I really want to focus on with you. So I'm going to stabilize on the sacrum. I want you to try to lift this leg up as high as you can for me. If you can. Is that painful
That's
there?
it.
Okay,
That's it.
relax.
I am so sorry.
No. That is completely fine. I want you to try raising the left leg. So you can raise that left leg though.
Yeah.
It's probably sore just
It
because.
gives it pain, but I can, yeah.
Okay. So what I want you to do, we're going to cross this foot over, over that one. So the table from below is going to come up.
Okay.
We're going to be doing a drop technique on that SI joint, okay?
Okay.
Alright, so what's happening is her sacrum is starting to point more towards that left side. So what we're going to do that P to A drop going down, and we're going to do a counterclockwise toward to bring that sacrum back to midline.
Okay.
One more. There we go. Uncross. I'm going to bend this knee. Good, just like that.
Ooh.
Sorry. No, that can happen.
Oh.
There we go.
Oh, God, it's hurting bad. Oh.
And one more. And relax. So for you, I know that you're having a lot of pain, so I want you to relax just for a minute. And to help that area, just so we know, we're going to relax it very lightly again. Just because I know for you this area is very inflamed. So we're lightly just going to go over the area again here. Okay. Now, I want you to try to raise this leg up.
That's it.
Okay.
I'm sorry.
No, that's completely fine. So yeah, so that pain now, that's still right here, correct?
Mm-hmm.
Okay, so that pain is right there, and you're still feeling it coming down?
Yes.
Okay. So what we're going to do, I'm going to have you flip over onto your back for me.
Okay.
So now that I have you laying like this, we're going to do a leg pull. With the leg pull, you'll feel some release in that ankle and the knee going up to the hip, okay?
Okay.
So we're going to start on that right side. This, I know, is that problematic side here. So just going to have you relax. How'd that feel?
Mm-hmm.
Okay. Good. Come on down just a little bit. Come on. I gotcha. Okay. Okay. And definitely quite a number on that side joint. Jeez. Okay. So what I'm going to have you do,
Okay.
I'm going to have you give yourself a big hug here, and that side. Go up and over with this one. Yep, just like that. Good. Okay, so I want you to take a deep breath in and exhale out for me. All the way down, all the way down. And there it goes. Okay, and relax right there. So now this, what we're going to do, the Y-strap. Now this, you're going to feel that decompression from the cervical spine going all the way down.
Okay.
So this is going to be
Do I need to scoot up or?
Nope,
Okay.
just like that. So I'm going to need help if you can pull your hair through for me.
Yeah.
Perfect. Good. No earrings. Now this one, this is where you're going to get a lot of the relief from, is right through here. Pull that out. There we go. Now that was the first time getting a Y-strap that decompression technique done, correct?
Yes.
How would you describe that?
I loved it. That was amazing.
So you felt how that just decompressed the spine?
Totally.
Took a lot of, just a lot of pressure and tension off. Okay. I want you to lay here just for a little bit. So the area, especially that we're working on in that low back, that it is inflamed quite a bit. I want to do a little bit more soft tissue work. We have aligned it. I'm going to just make sure, and I'm going to check the leg length, check a couple different tests, see how that is alignment-wise.
Okay.
But yeah, from there, I just want to see how that goes. Granted that it's been in a constant pain for a while now. It might take a day for the effects to actually really, just because with it being such a nerve issue, it may take a little bit, but I do want to just get it as relaxed as possible.
Okay.
If you can flip back over. Yeah, how's that feeling?
Mm-hmm. That didn't really hurt where you touched me.
Yeah, we're gonna go through also again with the massage device. So we really just want to relax this area. So it's right over that SI joint. Yeah, in her case, any type of bringing stress out of that area is really gonna help. Now I know you've done ice packs, hot packs, with, ibuprofen, just anything.
Anything to get relief.
Correct. Yeah, so I just want to relax the area here just a little bit. And what we're going to do after, I'm going to recheck the leg length and see if legs are balanced or if we need to do the side posture adjustment if it's more of a lumbar issue. Because I know it's the SI joint, but sometimes that SI joint can be affected with the L5 vertebra. So we'll check with that as well. How's it feeling this time though?
I feel much better.
Feels much better? Good.
Yes.
That is what I like to hear. Yeah, so we'll follow that down. Now that pain normally comes like this, going down?
Yes.
Okay. So we're going to follow that same pathway as well. Because we want to relax the entire area. So I know you're feeling it obviously deep through the glute, going down, feeling it in the back of the leg. Okay. Good. Okay, so we're going to come back over here.
Okay.
We're going to check the leg length. Actually, it's looking really good here. So originally, when we first did that leg length, this side was super short. And you'll also see when we do post the video and everything, you'll see from where it was in the beginning and then now when I push in like that.
I did.
Okay, well, I want you to stand up for me.
Okay.
Come up slowly.
Yes.
Okay, now obviously we're not going to keep poking in on that area just because we don't want to, if it's inflamed or anything, it's already been in pain. Now when you move around a bit, you don't need to go to full end range of motion, but just moving just a little bit.
I can go farther than I did. That doesn't hurt as bad now. Oh yeah.
Notice the difference?
Yes, big time.
Good.
Big
good.
time.
So yeah, what I did, so as you can tell, we didn't do the that normal side posture adjustment. I know originally, as you told me, you've had that done before. Now granted, everyone is a little bit different. So I'm not saying that obviously you guys see my videos. I do the side posture adjustments on a lot of patients, but if you're describing that to me and told me you're not getting relief, typically I'm going to see if that's not helping you, there's a reason why it's not helping you. So that's why when we check the sacrum, obviously when you tried raising that leg up, you were not able to at all. Now granted, I normally would have you check again, but I don't want to stress that joint anymore. Obviously, yeah, I want to give it a little bit. Obviously, just with that range of motion, you're already noticing a difference. The Y-strap, obviously, you got a ton of.
Oh, yeah, completely. Feels so good from that.
Okay, so how would you describe? I know, as you said, you've been to a chiropractor for a few months now. Hadn't been getting any relief.
This was night and day, just night and day. You did my entire body, and okay, I wish you would have told me to do this earlier. I couldn't do this at all. I could not do that at all. I promise, because I've been trying to stretch.
Yeah.
I can literally.
Please don't throw anything out. don't.
Okay. I'll stay still. But seriously, I could not do that earlier this morning.
You couldn't even move your leg.
I could not do that at all.
Okay. So yes, that it is still kind of inflamed, like almost like acute injury. Granted, I know you had it since October, but even when I say acute, when she laid down on the table, just any pressure, anything was already firing and hurting you that much. So yeah, typically I don't like to aggravate that area. We did the adjustment, we leave. We're not going to keep testing and poking and yeah, exactly. Kid with the stick or something. But yes, let me know further how that goes. Granted, I'm already seeing, and you're already noticing range of motion better. You're actually able to move your leg. Don't do anything stressful today.
Okay.
Relax. Increase the water. I normally would say, the ice packs and you've gone through everything. If you need it, do the icing, not heat.
Okay.
But
how long would you do that for?
For icing, 10 minutes on, 10 minutes off.
Okay.
And you could do that throughout the rest of, like if you sat down in the evening to watch a movie, you could do it throughout the entire movie. Keep it on, take it off. You'd be completely fine with that.
I'm so excited.
Perfect. So if anyone is ever looking to schedule an appointment, go right to the website, drjosephcipriano.com. Send a message. I try to respond within a day or two, but even as you can tell, I would hope, happy, satisfied.
Yes, absolutely satisfied.
Absolutely satisfied. So have a good one, everybody.